The Division of Community Health Services of the Ministry of Health proudly presents innovative products towards mainstreaming community health services in the devolved health system. Welcome, ladies and gentlemen. By looking at the Master Community Unit List, or MCUL, public website available at www.ehealth.or.ke/MCUL. As you can see, this is a subset of the master facility list, and for those of you who are digital, it is live and available on most devices. Go ahead and give it a try. Here you see the home page. At the top, an array of menu options available on the different pages. Centered at the bottom is a display of sample data available on the website about each community unit. And on the left, we have a quick search bar that enables a user to find community units around the country. Simply type it in and then click on the search link to see if the information is available. A website that provides more details about the community unit, including the unique CU code that distinguishes this community unit from other records in the database. That is 600417, as well as other details including the date the CU became operational, the name of the community health extension worker in charge, the number of households supported by this community unit, in this case 1,241, as well as the status of the CU, in this case semi-functional. The CU is supported by a health facility, and to find out more details about the dispensary as well as the exact location, simply click on the link of the name transfers you to the master facility list page bearing the details of this particular dispensary. Data available include the name of the dispensary, the unique master facility code or MFL code, where geocodes are available. Its location is identified on the map of Kenya, as well as other locational details including the county, district, constituency, amongst others. Important information available is the kind of health services available at this facility, as well as a list of all community units linked to this health facility. In this case, there's just one. This illustrates the link between the master facility list and the master community unit list. To go back to the MCUL website, you click on the link of the community unit name, this then transfers you to the search results page showing how many CUs have been found in this case 18 community units in Embu, as well as basic details including the CU code, name, location, and the facility to which each is linked. A user can then export this data to Excel by clicking on the link and then you will see the download, which you can then review for further analysis or comparison with other data. That is the basic outline of the website, content, and we encourage you to visit our website today and have your own experience with interacting with the data and available information. Materials available to support the website use include the MCOL report, which outlines the methodology that was used to collect and compile the data, the challenges faced, as well as the findings, which could be useful in educating others who would like to implement a similar exercise at the community level. We also have the Standard Operating Procedures Manual that provides specification on data requirements to be entered into the MCOL to ensure that the data contained is reliable, relevant, and consistent. The manual is targeted at super users or systems experts. We also have the Master Community Unit List Implementation Guide, which assists users in understanding how to create and manage CU records in the MCOL database. These reference materials are available in your packs, either in soft copy on the CD or in hard copy, and are also available on the website. We have the MCOL training manuals that include the curriculum and the facilitator's manual that guide on the content of training of users. As a result of the extensive work done on the MCOL database compilation, we are now able to map the distribution of the community units across the country. The community units are supported by health facilities, and what you see on the map is the representation of the health facilities across the country, represented by one green dot. We currently number over 8,000 health facilities, including hospitals, health centers, dispensaries, and private facilities. The CUs are represented by the pink dots on the map as a layer above the health facilities that support them. As you can see, their distribution, there are areas that are well covered, while there are other areas that provide opportunities for more CUs to be established. The geocodes used for the CUs are the same as those provided by the health facilities. We can also illustrate the distribution of the 2,100 community units across Kenya by their functional status, as shown by a blue dot representing those that are fully functional, a yellow dot for those that are semi-functional, forming the majority, and a red triangle representing those that are non-functional, expected to become functional as soon as they are provided with the appropriate support. Away from the MCUL, we also have reference material with regard to implementing the community health strategy, including the community health worker training curriculum, outlining the content of the training sessions for community health workers, we have the community health worker training manuals outlining the basic modules for training sessions with community health workers, during which they can discuss different scenarios, different challenges expected, and the different ways in which they can overcome the challenges. We also have the Community Health Services Monitoring and Evaluation Plan, covering a period of 5 years from 2012 to 2017, outlining how the successes and challenges will be monitored, and most importantly, how the community health strategy implementation is having a positive impact on community health services, their utilization, and their provision. The community health strategy requires effective communication for success. The strategy has been outlined in a document covering a similar period of the monitoring and evaluation plan to ensure that the strategy will be well communicated to the target group and the population at large. We also have the Community Health Services Briefs, which provide in simple terms the implementation of the health strategy, different methodologies used, the positive impact the strategy has had on health services and on health outcomes, as well as provides guidelines on how the strategy would be implemented in the emerging devolved governance system. The Community Health Services newsletter is published quarterly and provides the updates on activities implemented with focus on the counties, the experiences, the challenges, and the outcomes. The evaluation report provides the feedback on the assessment done in 2010 and the findings on the outcomes of initial efforts in implementing the community health strategy. In the document, you will be able to learn which were the best performing CUs, in which counties they are located,
as well as the results of the assessment. Finally, we have the Economic Stimulus Program Status Report, covering the years 2009 to 2012, outlining the achievements of the community level involvement and contribution in the National Blueprint Vision 2030. This is important in outlining how the community level is participating and contributing towards national development. Community Health Services is proud to share these important milestones today and encourages you to visit their website, share your experience, your suggestions, and your ideas. Afya yetu, jukumu letu. Thank you.